If you are over 75 and your doctor just congratulated you for finally getting your blood pressure down to 120 over 80, I need you to listen very carefully. Because for many older adults, that number may not be the victory it appears to be. In fact, in some cases, it may be the beginning of a completely different kind of danger. Not the danger of stroke from pressure that is too high, but the danger of dizziness, falls, weakness, confusion, and the kind of sudden loss of independence that can change a life in a single night. That is the part almost nobody explains. Because when people talk about blood pressure, the message is always the same. Lower is better. Lower is safer. Lower means you are doing everything right. And for many younger adults, that advice makes sense. Lowering blood pressure in midlife can reduce the risk of heart attack, stroke, and kidney damage over time. But here's what most people do not realize. The body at 75 does not respond the same way the body at 45 does. The blood vessels are stiffer, the pressure sensors are slower, the medications often stay in the system longer. And that means the target that looks perfect on paper may not be the target that keeps an older adult safe in real life. Think about where life actually happens. It does not happen sitting still in a clinic chair with both feet on the floor and a nurse taking one reading. It happens when you get out of bed in the middle of the night. It happens when you stand up too quickly from the sofa. It happens when you turn in a hallway, walk into the bathroom, or step into the kitchen before your body has fully adjusted. That is where blood pressure must do its real work. It must keep enough blood flowing to the brain, while the body changes position and gravity pulls everything downward. If it cannot do that, the number that looked so good in the doctor's office may be setting up a risk no one warned you about. And in the next few minutes, I'm going to show you exactly what I mean. I'm going to explain why the standard blood pressure target may not fit every person over 75. I am going to show you why slightly higher numbers may actually be safer for some older adults. And I'm going to walk you through a simple test you can do at home tonight that may reveal whether your pressure is dropping too low the moment you stand up. Before we go any further, do this for me right now. Drop your age in the comments, just your age. And if you have ever felt dizzy, lightheaded, or unsteady when standing up from a bed or chair, add the word dizzy. I want to see how many of you know exactly what that feeling is. Because once you understand what is really happening, you will never look at blood pressure the same way again. What makes this so dangerous is that it often looks like success at first. An older adult walks into a routine appointment. The blood pressure is a little above the standard target, maybe 146 over 84. The doctor looks at the chart and decides it needs to come down. A medication is added. A few weeks later, the pressure looks much better, 128 over 76, then maybe 122 over 74. Everyone feels relieved. The chart looks cleaner. The visit feels successful. The patient leaves believing something important has been fixed. But the body does not live on a chart. The body lives in motion. It lives in the instant between sitting and standing. It lives in the first step after getting out of bed. It lives in staircases, bathrooms, kitchens, and dark hallways. And that is exactly where trouble begins for many older adults. Because the question is not only whether blood pressure looks good while sitting still. The real question is whether that same blood pressure can still protect the brain, the balance system, and the muscles the moment the body rises and begins to move. That is where a beautiful number can become a dangerous one. For younger and middle-aged adults, the rule is often simple. High blood pressure damages blood vessels over time. Lowering it reduces long-term risk. That part is true. But after 75, the equation becomes more complicated. Not because high blood pressure suddenly becomes harmless. It does not. But because older bodies do not tolerate aggressive lowering the same way younger bodies do. A 78-year-old body is not simply a 50-year-old body with more years on it. It is fundamentally different in how it circulates blood, how it responds to gravity, and how quickly it adjusts when pressure changes. That means a target that protects one person may destabilize another. This is why some older adults with slightly higher blood pressure still function well, think clearly, and move safely, while others who reach the so-called ideal target begin feeling weaker, more tired, more foggy, and more unsteady. The lower number looks better, but the person feels worse. And that is the hidden trap, because the real goal is not to impress a chart. The real goal is to protect a living body that still needs strong circulation to stand, walk, think, and function with confidence. The first major reason this happens is arterial stiffness. When you are younger, your arteries are flexible. They expand when the heart pumps blood through them. That flexibility helps smooth out changes in pressure and keeps circulation moving efficiently to the brain and kidneys. But with age, those arteries become stiffer, less elastic, less forgiving. Think of a brand new garden hose compared with one that has been lying in the sun for 20 years. The old hose still works, but it does not bend or adapt the same way. That is what aging does to blood vessels. So when blood pressure is lowered too aggressively in an older adult, the issue is not just the number itself. The issue is whether that stiffer system still has enough force to send blood where it needs to go, especially upward to the brain when standing. If that force drops too much, the brain pays first. And when the brain does not get enough blood for even a few seconds, the person may feel dizzy, weak, off balance, or mentally cloudy. That is not a small thing. That is an early warning. Comment prompt 1. Quick check-in. If you are over 70 and you have ever had to pause for a second before taking your first step after standing up, comment pause below. Your comment may help someone else realize they are not imagining it. The second reason is that the body's pressure correction system slows down with age. Inside your blood vessels are tiny sensors that detect sudden drops in pressure and send signals to correct them. In a younger person, this system reacts fast. The heart rate adjusts, blood vessels tighten, blood pressure stabilizes before the person even notices a change. But in older adults, this response often becomes slower and weaker. So if an older person already has a low baseline pressure because of medication and then stands up suddenly, the correction may come too late. For a few critical seconds, blood flow to the brain drops. That is when the room spins. That is when vision goes dim. That is when a person reaches for the wall, the counter, or the edge of a chair. Sometimes they find support. Sometimes they do not. And in later life, one missed reach can lead to a fracture, a surgery, a rehab stay, and the beginning of a very different kind of life. The third reason involves medication itself. As the body gets older, the kidneys and liver often clear medication more slowly. A dose that seems ordinary on paper can stay in the system longer and have a stronger effect than expected. Add in dehydration, poor appetite, other prescriptions, and a body that already adjusts more slowly, and you have a situation where treatment becomes much more delicate than most people realize. One medication lowers pressure, another relaxes blood vessels, another pulls off fluid. Together, they can create a perfect storm in which the sitting number looks excellent, but the standing number becomes unsafe. That is why an older adult can be told everything looks great while quietly becoming more tired, more hesitant, and less steady at home. Not because the treatment failed, but because the treatment succeeded in the wrong direction. That is the difference between controlling a number and protecting a person. Let me give you a real-life picture of how this unfolds. Imagine a 79-year-old woman living independently. She manages her own bills, remembers family birthdays, cooks her own meals, and still enjoys going to church every Sunday. Her blood pressure has been running around 146/84, so the medication is adjusted. A month later, the number falls to 126/76. Everyone is pleased. Then little things begin to change. She starts pausing before walking after standing up from the sofa. She notices that getting out of bed at night feels a little strange, as if her body needs an extra second to catch up. She becomes more careful on stairs. She reaches for the kitchen counter more often. She tells herself she is just tired, but these are not random little changes. They are warnings, and if no one listens, the warning becomes an event. One night, one fast movement, one dizzy second, one fall. That is how many older adults lose confidence, function, and independence without ever being told the number itself may have become part of the problem. If this sounds familiar, comment steady if staying independent matters more to you than having a perfect number on paper. That one word says a lot about what older adults actually care about. This is why orthostatic testing matters so much. The name sounds technical, but the idea is simple. It asks one question that many routine visits never ask. What happens to your blood pressure when you stand up? You can check this at home with a regular blood pressure monitor. Lie down for 5 full minutes and let your body rest. Then check your blood pressure while still lying down. Write down both numbers. After that, stand up and check it again immediately. Not later. Not after walking around. Immediately. Then compare the readings. If the top number drops by more than 20 points, or the bottom number drops by more than 10, that is a red flag. It suggests your blood pressure may be falling too much when you stand. And this matters because a person can have a reading that looks wonderful while sitting or lying down, yet still be underperfused the moment they get upright. That hidden drop may explain dizziness, weakness, mental fog, and near falls that no one ever connected to blood pressure treatment. So what range often makes more sense in older adults? Not one magical number. A range. A middle ground. For many seniors, especially after 75, the safest pressure is not the lowest possible pressure. It is the pressure that reduces cardiovascular risk while still maintaining enough circulation to the brain, kidneys, and muscles. Too high is still dangerous. Stroke risk rises, heart strain rises, kidney damage can worsen. But too low creates a different danger. Falls, fainting, fatigue, confusion, poor kidney perfusion, loss of confidence, loss of mobility. That is why the sweet spot in later life is often somewhere in the middle, not extremely high, not aggressively low, just stable enough to protect both health and function. And this is where individualized care becomes essential. A healthy 68-year-old is not the same as a frail 84-year-old with arthritis, slower gait, and multiple medications. They should not automatically be pushed toward the same target. Now let me show you how two people with the same reading can need completely different approaches. Imagine two 81-year-olds. Both have a blood pressure of 158/88. The first has chronic kidney disease, weak balance, arthritis, and several medications already on board. The second is active, walks every morning, has good balance, and no major medical problems. Same age, same number, different body, different risk. If both are treated aggressively toward the same goal, one may tolerate it, and the other may end up dizzy, exhausted, and at high risk for a fall. That is why good care in later life must treat the whole person, not just the reading on the screen. So here is what matters most. Measure your blood pressure at home. Track it morning and evening. Do the standing test. Write down symptoms like dizziness, fatigue, foggy thinking, or unsteadiness. Bring the full picture to your doctor. Because in later life, blood pressure is not only a heart issue, it is a brain issue, a balance issue, a safety issue, and for many people, it is an independence issue. Before we close, comment informed if this changed the way you think about blood pressure after 75. Your comment helps spread this message to other older adults who may need to hear it. So now the picture should be much clearer. For older adults, especially after 75, blood pressure management is not about forcing the lowest number possible and calling that success. It is about keeping enough circulation going to the brain, the heart, the kidneys, and the muscles, while still reducing long-term cardiovascular risk. That balance matters, because if pressure is pushed too low, the cost may show up as dizziness, weakness, brain fog, falls, fractures, hospital stays, and the slow loss of confidence that makes a person stop trusting their own body. That is why this conversation is so important, because once you understand this, you stop treating blood pressure like a school grade. You stop assuming that a prettier number automatically means a better outcome. You stop chasing perfection on paper while ignoring the signals your body gives you in real life. And you begin asking a much smarter question. Not, is my number low enough? But is this number helping me stay safe, steady, clear-headed, and independent? That is the question that matters. You now know that a sitting blood pressure can look perfect while a standing blood pressure tells a completely different story. You know that older blood vessels are stiffer. You know that the body's pressure sensors react more slowly with age. You know that medications can linger longer and hit harder than they used to. And you know that dizziness, fatigue, hesitation, and unsteadiness are not symptoms to dismiss just because someone is older. Sometimes those are warning signs. Sometimes they're the body saying, "This target no longer fits me." And that awareness is powerful because it gives you language. It gives you clarity. It gives you the ability to walk into a medical appointment with more than a number. It gives you a pattern, a history, a list of symptoms, a real picture of what your body is actually experiencing. And that is how better decisions get made. So remember this. Do not focus only on the number. Focus on the number and the symptoms. Focus on the number and your balance. Focus on the number and whether you still feel confident when standing up from a chair, getting out of bed at night, walking through your hallway, or moving around your kitchen in the morning. That is the real test, not perfection in a chair. Protection in real life. If this gave you a new way of thinking about blood pressure, comment the word informed below. And if someone you love is over 65, takes blood pressure medication, and has been feeling dizzy, weak, foggy, or unsteady, send this to them. It may help them ask the one question that changes everything. Because growing older does not mean giving up your clarity, your confidence, or your stability. It means learning what your body needs now, not what it needed 30 years ago. Track your readings, track your symptoms, test what happens when you stand, bring the full picture to your doctor. The goal is not only to live longer, it is